And welcome to the Dr. Bob Show. In the United States, we're having an epidemic of obesity. People are getting more and more heavy. They're gaining weight. And when they gain weight, there becomes a problem with handling blood sugar. The body becomes resistant to insulin and blood sugar elevates and we get type 2 diabetes. With diabetes, there are changes in blood vessels that supply blood to the eyes, that supply blood to the heart, that supply blood to the kidneys, and to the extremities. All of those blood vessels can become damaged in the eyes, and we'll be spending most of this show talking about diabetes in the eyes. We call it diabetic retinopathy. My guest is Dr. Darin Smith. Dr. Smith is a board-certified ophthalmologist. He deals with diabetic retinopathy every single day. There are problems that occur, and there are answers to those problems. Hello, I'm Dr. Robert Overholt. I'll be your host for the next 30 minutes in the Dr. Bob Show. Later on, we'll be talking about problems with high blood pressure, systolic, diastolic, which is the most important and why, and aspirin. Can a low-dose aspirin a day keep a stroke away or keep a heart attack away? There are chances that it can, but there are problems and there are dangers. A lot of information for you. You'll want to stay tuned. We're talking with Dr. Darin Smith, board-certified ophthalmologist, and we're talking about diabetes in the eyes. We call it diabetic retinopathy. Darin, welcome to the Dr. Bob Show.
Hey, it's great to be here. Thanks a lot.
Hey, how important is diabetes in the eyes?
Oh, gosh, Bob, I'm glad we're doing an entire show on it because it deserves that and more. It's basically all day long, I'm seeing patients who have diabetes and who are there to get their eyes checked. So it's vitally important.
So is it important that if the primary care doctor recognizes a patient has diabetes, that the eye exam is an important part of their overall health?
Yeah, you bet. So diabetes is one of the leading causes in the world of preventable vision loss.
So why is that? What does diabetes do to the eyes?
So, diabetes, of course, everybody knows diabetes has to do with the blood sugars and having high blood sugars, that sort of thing. But at the end of the day, diabetes affects small little blood vessels. And so the eyes, especially the retina in the back of the eye, has a lot of small little blood vessels that can be really impacted by high sugars over time.
So the retina is in the back of the eye. What does the retina do?
Okay, so if you think back when cameras actually had film, they don't have film anymore, but when they did, the retina is like the film. So the lens and the cornea focus light, and that they focus the light back onto the retina, and then the retina takes that image and sends it back to the brain for processing.
So diabetes can damage the retina. It's the vessels, the blood vessels that supply the retina?
That's right.
So what happens to those blood vessels and what do you see?
So what we see when someone has diabetes, we can see a few different things. So early signs of diabetes will be very small little hemorrhages, little dots or little blots of blood.
Do we know why those little dots of blood, those little hemorrhages, do we know why they happen?
Yeah, so what's actually happening on a real kind of microscopic type of level is the little capillaries in the retina get clotted off. And so they stop being able to perfuse the blood, and so oxygen and the nutrients that the retina needs, it doesn't get there. And so along with that, you get a little bit of blood, and so sometimes you can also get a little bit of fluid, some leaking fluid. So you can see some protein and some swelling of the retina.
Can you recognize that as an ophthalmologist and you're looking at the eyes? Can you recognize those little hemorrhages?
Yes, you can.
What do they look like when you look at them?
So in the very early stages, there's something called microaneurysms. So it's just a little outpouching of those little capillaries, and that just looks like a little dot of blood. And then those are the smallest things we see, and then sometimes they're a little bit bigger, just like a little dot or a blot of blood there. Sometimes we can actually see some thickening of that retina if there's been enough leakage of fluid, that actually retina will swell and we can see some protein buildup.
When you see that, do you say, uh-oh, this person has problems, we need to get to work? Or how do you tell the patient that they've got these early findings of diabetic retinopathy?
Yeah, so that's a great question. It all depends on how much we're seeing back there and really where those areas are located. So if that leaking, for example, is significant and in this area of central vision, well, that's a situation where, you know, vision could really be impacted, and that person probably needs some additional tests and maybe some treatment. On the flip side of that, sometimes someone will come in and we'll see 1 or 2 little dots, and it's really no big deal, but it's a reminder for those folks to keep good sugars, you know, keep the blood sugar under good control, because that's the most important thing that folks can do for themselves. And then we start following them a little more closely just to make sure that we catch something early before it gets really problematic.
I sometimes think that people don't realize how important it is to keep their blood sugar at a normal level. You know, well, I'll cheat a little bit, or I'll do this, or maybe I'll cut down on eating before I go see the doctor. But there are tests now that pretty much show what your blood sugar has been for the last 3 months, and it's so important to keep it at a lower level. Now, if the diabetes progresses, we've got little microaneurysms, little hemorrhages, what goes next?
So those kind of changes that we were just talking about, the swelling and the little splotches of blood, that would be called non-proliferative, or what's called background diabetic retinopathy. So
the word non-proliferative is an important term.
It is, because the other type, what you're asking about, is something called proliferative diabetic retinopathy. And what happens with that, you know, I mentioned how those little capillaries kind of stop, you know, having the blood flow. And so when that happens, the retina starts to die. Where there's no blood flow, that retina starts to die. It's starving for nutrients.
Then you couldn't see?
Right. And so it sends out signals saying, hey, I'm dying over here. I need more nutrients. And so the way the body responds is it starts making new blood vessels to supply that retina. Sounds like a great idea, but it's terrible, because those new blood vessels are very small, they're fragile, and they can break and they can bleed so much where the entire eye fills up with blood.
Wow.
They can scar, cause retinal detachments and terrible glaucoma in a situation that you just don't want to go down that road.
So are there treatment for all of those things that you talked about, retinal detachment, about hemorrhage, blood into the eyeball itself, into the vitreous we call it? Are there treatments for those?
Yes, there is.
So let's go back. Let's go back to the non-proliferative, and we've got little microaneurysms. What if some of those occur? You mentioned earlier the central vision.
Yes.
What part of the retina is that?
So that's called the macula. Okay, so the macula is responsible for about 90% of our actual seeing, what we use when we're reading or watching TV or driving and that sort of thing.
Do these hemorrhages hit that area with more veracity?
It can.
Yes.
Yes.
It can.
Yes, sir.
So, and you can see that around the macula. It's easy to see the macular area, and you get the little hemorrhages. What's macular edema?
Okay, so edema just means swelling.
Yes.
And so if we get swelling of the retina, so remember the retina is what's capturing the light. Okay, so if the retina is getting swollen, it's not going to be able to do as good of a job capturing that light. And so it can cause, that's one of the causes of significant decreased vision in diabetic retinopathy. So the way that would be treated historically, when I was training, the only way to treat that would be with little laser treatment, okay, which was called focal laser of the macula. So nowadays, that's actually being changed over to getting some injections in the eye, similar to what people get injections for macular degeneration.
So here we have the eye with some non-proliferative changes and some proliferative changes, new blood vessel growth that we thought would be good but is not good, little small vessels in the non-proliferative that are not giving enough nutrient to the eye. We can get edema of the retina, and there's treatment for all these?
Yes.
And that's what we're going to be talking about when we come back. If you've got changes in your eyes from diabetes, from obesity, from elevated blood sugar, there is treatment that's available. We're going to be talking about that treatment. It's very, very exciting, very, very new, and very, very helpful. We're talking with Dr. Darin Smith, and we're talking about diabetes in the eyes. We're talking about diabetic retinopathy. If you have diabetes, if your blood sugar is elevated, be sure that you have your eye exam. Be sure that the ophthalmologist dilates up the eye and he can see little changes, some microaneurysms, some little bitty hemorrhage dots, and can see how deep and how involved the diabetes in your eyes. You and I were talking earlier, you said diabetes can cause blindness. And the blindness we can't see, and it's all in the hands of the person by the way they control their diabetes and how they work out a plan with their doctor.
Yes.
So let's talk about the diabetes as it progresses and what we can do for it.
So, you know, we talked a little bit about the non-proliferative with the little macular edema and that sort of thing. So the next step, and we briefly touched on this, is something called proliferative retinopathy. And that's where the new little blood vessels start to grow, and they can break and bleed and fill up the eye with blood, and actually sometimes cause enough scarring that the retina will detach. It can also form something called neovascular glaucoma, which is a particularly nasty, very difficult type of glaucoma to treat.
Do you see these changes much, this proliferative part? Where
Unfortunately.
Yeah. And are there things that we can do for that?
So there is. So I mentioned that there are some injections. So there are sometimes the injections are starting to happen a little bit more for the proliferative, but the laser treatment is still, I think, the gold standard for proliferative retinopathy. But what we do with that is people will get hundreds and hundreds of laser shots in the peripheral retina.
Do you have to shoot the laser beam 100 times?
Oh,
or can you scatter it out? Or do you have to go at each individual little dot?
Each dot is a different shot, and there'll be hundreds of shots. And so, but what that does, remember I mentioned earlier to you about the retina that was kind of dying off?
Yes.
And so you're basically taking that retina, killing some retinal cells that are already almost dead, so that the signal for those new little blood vessels is removed, and that will help get rid of those new little blood vessels.
So the eye, the vision that was being destroyed, can come back toward normal?
So what you're doing is you're killing off some retina in the periphery in order to save the vision in the center.
It seems like it has to be very, very, very meticulous and very, very knowledgeable to go in and attack the right areas of this.
Oh, absolutely.
There are some shots that we inject into the eye. What are those shots as far as diabetic retinopathy goes?
So the main one is like, again, it's a similar for macular degeneration where we get swelling of the retina for a different reason. So the what's called an anti-VEGF injections can actually reduce swelling of the retina. So it can be very effective in the treatment of the diabetic macular edema.
So there's a hormone vascular epithelial growth factor that causes problems, and you can inject those growth factors.
Yes,
is that right?
That's exactly right.
And that keeps the eye from dying. Do you see that commonly?
Oh, we see it all the time.
That's pretty scary.
This is almost like an epidemic. I mean, we see, I don't know how many diabetics I see a day. I see a bunch. The retina doctors who do a lot of the injections stay busy all day long doing injections for diabetes as well as the macular degeneration. So it is something that we see far too often, especially for something that's controllable. I think that's one of the messages we need to get across is that this is controllable. And the other thing, what's going on in the eyes with the little blood vessels in the eyes? Well, the same kind of thing is going on in the kidneys.
Yeah.
Going on in the peripheral vascular system is why people, diabetics end up losing their feet, end up on dialysis, and so diabetes can be just a terribly wicked disease if it's not taken care of.
So if you inject the eye, let me go back. If you get hemorrhage into the eye, if those blood vessels fill the eyeball with blood, that just scares me to death to think about it. What do you do for that? And what danger does that cause?
So that by itself is not necessarily bad. I mean, the blood will either clear, or most likely, if someone comes in and has a sudden loss of vision and they come and see me and I see that they have an eye filled up with blood, I will send those patients over to the retina doctors. And most likely, a diabetic in that situation will end up having to go to the operating room, where a retina specialist will take out the blood back there and do all those little laser shots we were talking about right during surgery.
So every problem that we've talked about with diabetes that can eventually cause blindness, there is an effective treatment for it. But before it starts, it's in the hands of the owner who owns the eyes that says, get your blood sugar under control.
Exactly.
Be sure that you exercise, be sure you know what your blood sugar is, be sure that you keep it in a normal level. And that can be done. People can get their blood sugars normal if they work out the program with their doctor. How often does the diabetes in the eyes progress to blindness?
I don't know the exact an exact figure or percentage, but I see it. Now, what I see oftentimes, more often, fortunately, is people that have had what's called the PRP laser, all the laser scars, and we've been able to, they've had their vision saved. They may not have perfect vision, but they didn't go blind.
Yeah, their vision was saved.
So it is vitally important to be seen, to not just take care of yourself, for the blood sugar and that sort of thing. That's very important, of course. But to make sure that you don't just blow off, doctor visits. Because anything that we can catch earlier, the better we're going to do as far as getting you treated and keeping vision at the highest level possible.
So if my doctor says, Dr. Bob, your blood sugar's a little high, I should immediately say, I want my eyes checked. Yeah. How often should I have my eyes rechecked? Let's say you examine my eyes and you say, well, Bob, I don't see any bad signs of diabetes in your eyes. We need to see you back.
Once a year.
Once a year.
Yeah.
6 months, I'd feel better.
So 6 months isn't really necessary. So what I'll do is, if we start to see some very mild signs, we mentioned those little micro aneurysms, a couple little dots here or there that are in an area that's not really vision threatening, I will just encourage good blood sugar control and see those folks back every 6 months. Because again, if they start getting worse, you want to catch them earlier than later. But for people who do not have any signs of diabetes in the back of the eye, once a year is the normal recommended follow-up.
At what age do we start seeing problems in the eyes with diabetes?
Gosh, anytime. It's really it's a function of how long a person has had diabetes and how well controlled or poorly controlled that diabetes has been over that kind of time period.
I've read if people get diabetes, and if it's just simple, easily controlled diabetes, that eventually you're going to get eye problems. And if that's the case, it's very important that you find those problems early, because there is so much treatment that you have available. To me, it just is amazing what you're all able to do to preserve vision and keep people from going blind. We're getting better and better, and I'm sure we'll be more better in 5 years. But thank you for the work you do and for the vision that you save people that have eye problems with diabetes.
Well, thank you, Bob. Thank you for having me.
Remember, if your blood sugar is elevated, it's a sign you need to be sure that you try to protect your eyesight. So talk with your doctor, see your eye doctor, get the examination that will help preserve or keep you from getting blind. And now you're going to want to stay tuned. We're going to be talking about problems with high blood pressure, which is the most important, the systolic upper number or the diastolic, the lower number, and aspirin. Aspirin, sometimes we're told it'll keep us from getting a stroke or a heart attack. Does an aspirin a day keep a stroke away? No, sometimes yes, sometimes no. There's lots of problems that can occur. You'll want to stay tuned and learn about those. I want to thank Dr. Darin Smith. Wonderful discussion on diabetes and diabetic retinopathy. If you have an elevated blood sugar, be sure that you put eye exams, regular eye exam, on your treatment program. And now questions from you, the viewer, that I think will be important to your health. Dr. Bob, question number 1. Which blood pressure is the most important? The systolic, the upper number, or the diastolic? Normal blood pressure, normal, 120/80. If the blood pressure gets above 140, the upper number, that's systolic hypertension. If the lower number, which normal is 80, gets above 85, that's the diastolic. So Kaiser Permanente in California, La Jolla, did a study measuring some 1,300,000 blood pressures. And they followed the people that they had abnormal blood pressures for 8 years to find out which one seemed to be the most problematic, the systolic or the diastolic. Now let's remember, with high blood pressure, we've got a pressure that the heart has to beat against, and the heart has to create enough pressure to throw the blood past those blood vessels that have high blood pressure. When that happens, when that pressure is there in the blood vessels, they can burst, they can clot. We can have a burst blood vessel in the brain, hemorrhagic stroke, or the blood vessels to the brain can be infarcted, they can be damaged and can clot off. So is that happen more with systolic or with diastolic? If we have hypertension of a prolonged period of time, it can bother the kidneys and cause kidney failure. So blood pressure control is extremely important, and it's fairly easy. There are things that we can do to control our blood pressure. We can exercise more and on a regular basis. We can handle stress better. We can cut salt in our diet. We can get our weight proper. We can control our cholesterol and we can stop smoking if we smoke. If we do those things, we'll find that our blood pressure will begin to lower and come back to normal. Very important. Every time you see the doctor, stick out your arm and say, "While I'm here, could you get my blood pressure?" And write those numbers down. Put them in a place where you know that you can discuss with your family doctor what your blood pressure is. There's nothing like a home blood pressure cuff, where you measure your own blood pressure twice a week and record those. And you can tell your doctor what your blood pressure does at home as well as in the doctor's office. Excellent medications to control blood pressure. And so we know that it's a problem that can be treated. So if you've got high blood pressure, pay attention to it, get it under control with you and your doctor. Question number 2. Dr. Bob, should aspirin be used to prevent heart attacks and strokes? Well, the leading cause of death in the United States is cardiovascular blood vessel disease. And we do know that one of the problems is those blood vessels can become damaged and there can be blood clots. The blood clots are because platelets don't work, and the platelets allow the clotting to occur. So aspirin, baby aspirin, will keep the platelets from causing blood clots. So that seems simple. Shouldn't we use aspirin to keep strokes and heart attacks away? Well, no, a simple baby aspirin a day in certain people can increase the frequency of GI bleeding, so we can get bleeding from peptic ulcers and from gastric ulcers. And so aspirin is not a simple medicine. Some people have severe allergic reaction with asthma and aspirin sensitivity. So what we have to do is we have to look at risk factors of heart disease. So the risk factors are smoking, elevated cholesterol, elevated blood pressure, increased weight, not handling stress well, not sleeping properly. So if we can look at risk factors and we can control those, then we need to look at the stomach. It gets down to the following. If you've got no risk factors of heart disease, then the chances are you don't need baby aspirin. If you've got 1 or 2 risk factors and no evidence of heartburn, acid indigestion, then a baby aspirin a day may be the medication for you. If you have 4 or 5 risk factors and you have stomach problems, you're in trouble. You're in trouble because aspirin may increase the incidence of GI bleeding as it is protecting you from getting a heart attack and stroke. So one of those things you have to talk over with your doctor. If you have had a heart attack, then baby aspirin a day is usually a treatment that your doctor will want you on. That's all the time that we have for this show. Remember those 4 things that we recommend in the Dr. Bob Show. Number 1 is regular exercise. Regular exercise is as important as anything that you can do. So get those tennis shoes out and start doing a walking exercise program. Get 7.5 hours of sleep. Sleep interferes with your health. And so if you're not getting proper sleep, know that your chances of getting a problem from lack of sleep are going to be great. Eat properly. Eating proper foods will help you lose weight, keep your weight good, cut down on cholesterol, blood pressure. Remember, what you eat is what you are frequently. And most of all, what is it that we like in the Dr. Bob Show? It's that laughter in your life. Be sure you don't shortchange laughter. Find somebody that you love, that you like to tell stories with, that you laugh and you giggle and you have a good time. Because the more you laugh, the healthier you're going to be.